What are the chances of seizure freedom after epilepsy surgery? Imagine a treatment that could potentially give relief from persistent seizures. For many with epilepsy, surgery offers that hope. The success rate varies based on several factors, including the type of surgery and the underlying cause of seizures. One common procedure is temporal lobe epilepsy surgery, which targets the part of the brain where seizures often start. About 73% of patients who undergo this surgery experience significant reduction or complete freedom from seizures. This makes it one of the more effective options for suitable candidates. Another type is extratemporal lobe surgery, which addresses seizure foci outside the temporal lobe. The seizure freedom rate here is slightly lower, around 60%. This depends heavily on the exact location and how well the surgery targets the seizure source. More extensive surgeries, like hemispheric procedures that remove large parts of one side of the brain, can lead to high seizure freedom rates, with about 75% of patients experiencing substantial improvement. These are usually reserved for severe cases where seizures affect one hemisphere significantly. The underlying cause of epilepsy also influences outcomes. For example, if a tumor is causing seizures, surgery to remove it often results in seizure freedom in over 79% of cases. Mesial temporal sclerosis, a condition involving scarring in the temporal lobe, has a similar success rate of around 78%. However, for conditions like hypothalamic hamartoma, the chances are lower, with about 46% of patients achieving seizure freedom. In recent years, minimally invasive techniques such as laser interstitial thermal therapy and selective laser amygdalohippocampotomy have gained popularity. These procedures tend to have slightly lower long-term seizure freedom rates, around 57%, but they often come with fewer complications and shorter recovery times. It's important to remember that each person's situation is unique. Factors like the exact location of seizure focus, the type of underlying pathology, and overall health all influence the chances of success. Surgery can be a powerful option, but it requires careful evaluation and planning by a team of specialists. If you or someone you know is considering epilepsy surgery, consulting with a healthcare professional is essential to understand the potential benefits and risks tailored to individual circumstances.